This tiny pill has saved lives. Some studies suggest aspirin may reduce the risk of heart attack and stroke, especially in those who already have signs of arterial plaque. But over the last few years, the medical advice around aspirin has changed. So what's going on? And what should you know before using aspirin for your heart? Let's break it down. In 2022, the U.S. Preventive Services Task Force updated its recommendation. Low-dose aspirin should no longer be routinely used to prevent heart disease in older adults with no history of cardiovascular issues. Why? Because for people without a history of heart events, the bleeding risks may outweigh the benefits. Aspirin interferes with platelets, tiny cells in your blood that help it clot. It blocks a chemical called thromboxane A2, making platelets less sticky. That means clots are less likely to form inside narrowed arteries, the kind of clots that can cause heart attacks or strokes. Some other blood thinners work deeper in the clotting cascade, but aspirin focuses on platelet activity, an early step in the clotting process. The roots of aspirin go back thousands of years. Ancient civilizations used willow bark to reduce fever and pain. In 1897, a chemist named Felix Hoffmann synthesized acetylsalicylic acid, what we now know as aspirin. He worked for Bayer, a pharmaceutical company that helped commercialize it globally. Since then, aspirin has been a household name, used for everything from headaches to heart protection. Despite its long history, aspirin isn't without risk. The biggest concern? Bleeding, especially in the stomach or intestines, sometimes in the brain. Some experts suggest that if aspirin were introduced today, it might require prescription due to these risks. That's why aspirin use is now more selective, especially for those without confirmed heart disease. In medicine, prevention falls into two categories. Primary prevention is for people with no history of heart problems. Secondary prevention is for those who already have signs of heart disease, like plaque in the arteries. Recent guidelines emphasize that aspirin is no longer routinely recommended for primary prevention, but it may still be helpful for secondary prevention under a doctor's care. Plaque is a soft, inflamed mix of fats and immune cells that builds up inside artery walls. It's not always about the size of the blockage. It's about how unstable the plaque is. When a plaque ruptures, it can trigger a sudden blood clot, which can block blood flow entirely. That's what leads to heart attacks and strokes. So who might benefit from aspirin? People who have already had a heart attack or stroke, have confirmed plaque buildup, are at low risk for bleeding. Who might want to avoid it? Those over 60 with no signs of heart disease. Anyone with a history of ulcers or bleeding. Again, this isn't medical advice. It's a conversation to have with your healthcare provider. Stress tests are often used to check for heart risk. But here's the catch. These tests usually only detect blockages that reduce blood flow by 50% or more. The problem? Most heart attacks happen in arteries that are less than 50% blocked. So a normal stress test doesn't always mean your arteries are healthy. Atrial fibrillation, or AFib, is a common heart rhythm problem that increases stroke risk by up to 5 times. But aspirin hasn't been shown to effectively reduce that risk. Experts usually recommend prescription anticoagulants, like Eliquis or Xarelto, for AFib patients, especially if they're older or have other risk factors. Newer oral anticoagulants, known as NOACs, target specific clotting factors, such as factor XA. They've been shown to be more effective than aspirin for stroke prevention in AFib patients. But like aspirin, they carry bleeding risks. That's why any blood thinner, natural or pharmaceutical, should be used under medical supervision. Some natural compounds may have mild blood thinning properties. 1. Fish oil, 2. Turmeric. 3. Garlic. 4. Ginger. While promising, most of these lack the strength and consistency of prescription medications, and they can still interact with drugs. So caution is needed. No pill, not even aspirin, replaces healthy living. To protect your heart, 1. Eat a balanced anti-inflammatory diet. 2. Exercise regularly. 3. Get quality sleep. 4. Avoid smoking. 5. Manage stress. These habits lower inflammation, reduce plaque formation, and support long-term artery health. For many, the first sign of heart disease is the heart attack itself. That's why early screening, such as carotid artery ultrasounds or CMT tests, can be powerful. They help identify plaque before symptoms appear. Some people discover plaque despite healthy habits and begin a new chapter of prevention, including medication and lifestyle change. Aspirin may help some people avoid a second heart attack or stroke, but it's not a one-size-fits-all solution. Talk to your doctor. Understand your risks. Make informed decisions. And above all, take care of your heart.